Hi, my name's Katie. I am the nurse manager here at My Choice Medical, and today I'm going to be talking to you guys about chlamydia. So chlamydia is an STI, so that's a sexually transmitted infection. We'll be talking about infections and diseases. So sometimes people use those interchangeably, STI, STD, sexually transmitted infections versus sexually transmitted diseases. It's not a huge difference. But so chlamydia is an infection. It is caused by a bacteria. It can cause infertility in both men and women. A lot of times people think that chlamydia isn't really a big deal, but as we'll start talking, it is treatable, but it can be a big deal if it causes you infertility issues, which can happen. Younger women tend to have the most damage done by chlamydia if they do have it, and especially if they have repeated occurrences of chlamydia. Chlamydia is often asymptomatic, so asymptomatic just means there's no symptoms. In our clinics, we have a lot of girls come in. They just come in for general testing, and there are times that they've had no symptoms, and they are positive for chlamydia. If you do have symptoms, those symptoms for chlamydia can be a white, yellow pus, bleeding, pain with urination. Chlamydia, as I said, can be cured. We can treat that with antibiotics. However, if chlamydia goes undetected for long periods of time, and if it goes up into your uterus, further into your tubes, which are your fallopian tubes, they come off of the uterus on both sides. If chlamydia resides there and causes scar tissue, that scar tissue can cause infertility issues. So the egg that's in the ovary travels from the ovary through the fallopian tube down into the uterus, where for procreation would come in contact with sperm. However, if there's chlamydia scarring in the tubes, that egg is not able to pass through that, which can cause the infertility. In men, there can be urethral damage, scar tissue in the urethra, that also can lead to infertility. So chlamydia for men is definitely something that if there are symptoms, they will notice. If there is drainage coming out of their penis, that is typically a problem for them. So they tend to be able to get treated quicker because they can notice it quicker with symptoms. For women, because of our anatomy, where that drainage is further up inside the vagina, where the cervix is. So that is where the drainage is going to be, and that's not seen by the naked eye. So sometimes women have drainage different days of the month, different times of the month, whether it's premenopausal, post period. So basically before, after, during your period. During ovulation, there can be drainage. The vagina is a moist environment. So if there's other body fluids, all of those things can contribute to maybe a girl not noticing that she has chlamydia if she has symptoms. So it is very important to get tested. Condoms absolutely reduce your risk for contracting chlamydia. However, they are not the be-all to end-all. There is a failure rate there that I'm sure we've discussed in other videos. So just be aware that just because someone thinks that they might not have chlamydia, they definitely could.